Did you know that the World Health Organization estimates that worldwide there are about 19 million children with visual impairments? It is also estimated that about 50% of childhood blindness is preventable or treatable. Childhood blindness can be prevented with pediatric vision screenings. Pediatric vision screenings help detect children at risk of vision disorders. Having good vision is so important for children. When children have poor vision, it is associated with increased mental health issues, increased risk of complete blindness, lower educational achievement, and reduced future opportunities. To help us get a better understanding about pediatric vision disorders and the importance of pediatric vision screening, meet optometrist Yasmin Jindani.
My name's Yasmin. I'm an optometrist. I work in private practice for a portion of the week, seeing patients of all ages, and then I also work with McMaster University doing a lot of research. So I'm part of the McMaster Pediatric Eye Research Group. I manage that group where we work on a multitude of different projects looking at different pediatric eye conditions. And then I also work with the Indigenous Children's Eye Examination Project, where I'm the lead optometrist and national coordinator for that.
So, what are vision screenings and how are they different from eye exams?
So vision screenings are actually quite different than a comprehensive eye exam. When you visit an optometrist and you have a comprehensive eye exam, they're actually checking not just the front to the eyes, the overall health and your binocular vision system, but the biggest thing is checking the retina, making sure there's no any eye conditions happening. Whereas in a vision screening, it is exactly what it says. It's more a screening. And the idea is that if there's any concerns detected with the eyes, that we connect you with an optometrist for a full eye examination. So again, a screening is using 3 specific tests. We're able to hopefully identify any children that may have issues with their eyes and need further treatment and care.
What are the goals of vision screening?
There's actually a few. I think the main one that we advocate for is, again, identifying children that may have issues with their eyes, and not just uncorrected refractive error, but other conditions as well, such as poor vision in one eye, which needs to be detected and treated during their informative years of development to help prevent irreversible long-term vision loss. Another goal would be for increasing awareness. A lot of times when you speak to parents or guardians, they're unaware that children should be getting an eye exam at a young age, ideally before school starts. So again, it's connecting children with their local optometrist for ongoing care.
What pediatric eye disorders can vision screenings help detect?
The conditions that can be detected during a screening are uncorrected refractive error. So if a child may have a condition like myopia, which is short-sightedness, hyperopia, which is farsightedness, or astigmatism, which may be causing poor vision at both distance and near, it can detect and, again, refer you to an optometrist where these conditions can be corrected, usually with eyeglasses. But again, another condition would be when there's weaker vision in one eye, which isn't often obvious because one eye tends to see pretty well and the other eye is a lot weaker. So again, detecting conditions like that, which is called amblyopia, and initiating further treatment and care at an early age is very important.
We just went through a bunch of different eye disorders. Let's go through some of them again, but this time a little bit slower and with a little bit more detail. Amblyopia, often referred to as lazy eye, is a condition that affects the way a child's eyes see and work together. It happens when one of the child's eyes is not as strong as the other. The brain likes the stronger eye more and relies on it, while the weaker eye gets less attention. This leads to reduced vision over time. The weaker eye becomes less sharp, making it difficult for the child to see clearly. The good news is, if amblyopia is caught early, it is treatable, and the weaker eye can become stronger. Strabismus is another disorder of the eye, also referred to as crossed-eyed. It happens when the muscles that surround the eye are unable to coordinate both eyes, resulting in the eyes looking at different objects at the same time, hence the term crossed-eyed. When the different images are perceived simultaneously in the brain begins to ignore the image coming from the weaker eye. If left untreated, the weaker eye will never see properly, which can lead to amblyopia. Another disorder to consider is myopia. This is also referred to as nearsightedness. With this condition, objects which are near appear clear, but objects that are far away appear blurry. This occurs when a person's eyeball grows too long from the front to back. On the other hand, hyperopia, also known as farsightedness, is a condition where objects which are close appear blurry, but objects far away are clear. Hyperopia occurs when the eyeball grows too short from the front to back. What does the vision screening process look like?
A vision screening does entail 3 specific exams. The first one is testing the distance visual acuity, which will basically tell you how well a child can see far away. Now, if you've had an eye exam before, that tends to be where we use the chart. It's called the Snellen chart with the letters that you're asked to identify. And we do that on one eye at a time, and then as well as both eyes together. And that can right away tell us if vision is decreased in one eye, both eyes, and how well a child may be seeing in the classroom. And a second test is what we call stereopsis. So that's actually checking a child's depth perception. So that's part of a binocular vision test, which is very important. And then the third test is actually using a handheld autorefractor. And again, an autorefractor is the one that tells us whether a child may have uncorrected refractive error, such as myopia, hyperopia, or astigmatism.
What are some next steps parents can take after a vision screening to better their child's eye health?
I think as a parent, it's important to know that a child can have an eye exam as early as 6 months, even younger. I mean, I've seen children in my own practice and clinic at 1 month old. And that's if they notice that maybe the eye is turning in, out, up, or down. So again, looking out for any of those obvious signs. But again, just as a parent, watching if a child is able to, just with an object, what we call fix and follow. So moving an object around, seeing how the child's eyes move, and being sure to get those regular eye exams, ideally before this child starts school, and then every year after that.
Taking care of children's eyes helps prepare them for a brighter future. It is very important to regularly get our eyes examined to maintain good eye health. For more information and additional resources, please check the description box below or seek guidance from a local professional optometrist or ophthalmologist.